We are in an incredibly vulnerable place whenever we seek care of some kind. And there are so many ways that modern healthcare has that it can be dehumanizing. And there's a lot of messaging around personalized care or care that puts patients in the center, care for human beings and things like that. But there's not much of an explanation around what that means and how that's accomplished. And I think the simplest way to define what it is to be human is our ability to tell stories. There are other species that communicate. There are other species that are certainly social. There are even other species that have been observed tending to one another's wounds in rudimentary ways, but we are the storytellers. And because of that, storytelling and caring for one another go hand in hand. The experience of seeking care, no matter what era we're talking about, has always been about telling our story and then having that story told back to us in a meaningful way and in a way that can be acted on. And today, when we as patients tell stories to a healing professional, we are expecting it to be told back to us in terms of biochemistry and anatomical tissues, but that underlying need is the same. We want these health problems that we experience interpreted and then told back to us in a way for the sake of being able to intervene in those stories. And so improving health and healthcare has to take that bedrock of communication into consideration, whether we're talking about trying to improve the quality of care or the equity of access to care or making the experience of getting care more personable and more human. Understanding why stories make us human, how important stories are to the ways we communicate about ourselves, and how stories orient us toward action. All of that has to be a part of the process of improving care and how we care for one another.